background noise from me.
All right. Welcome to the State of the Nation. My name is Henry Ssali, and this is the State of the Nation. How is everyone doing? Something important that we are going to discuss today. But before we start, why don't we proceed and listen to Mr. Kampala. What's in Kampala? All right. Welcome back. My name is Henry Ssali, and this is the State of the Nation. We do have our regular panelists joining us here today to discuss an outbreak in Uganda, the Ebola outbreak. Of course, we know at this moment there's about 35 people who have been infected, about 7 dead, including a few physicians or medics, and another 18 others in critical condition. In studio today, I have my brother, Mr. James William Mugeni, and of course, Mr. Mitala Muzukulu wa Muswangali. Dr. Joel Mirembe is supposed to join us, but he's still attending to a critical issue in Kampala. He will be joining us when he gets that freedom, that time to join us. At this moment, I want to invite Brother Mugeni to introduce himself and tell us why this conversation is important to him. Mr. Mugeni, welcome to the State of the Nation.
Yes, so much, Mr. Ssali, and greetings to Muzukulu. I hope you're also. Yes, Mr. Ssali, are you able to hear me very well?
Yes, we do hear
technology
you.
challenges me. I told Muzukulu last time one of the challenges I have in America is technology, because I come from Uganda. I came from Uganda rather, but still I come from Uganda. Yes, I'm James William Mugeni, a medical clinic officer by profession. I worked for most of my time in Uganda, both at referral, regional health centers, and finally with the CDC. You've just asked one very important question: why this topic is important for me. We are discussing Ebola. And Henry, maybe, I don't know whether that is clear to you. I don't know whether you can see it. I don't know whether it is in the view that you can see.
Certificate of Recognition, Ebola Outbreak Response Team 2000, October 2000 to February 2001. Is this Mr. Mugeni being recognized?
Then, yeah, that was then.
That was then. Yeah.
That was then.
Okay.
And one very important thing I would like to stress and mention straight, that if it comes to capacity building, we are there, but perhaps where are we? It's like, have I retired? Am I good enough to be engaged in Ebola? Henry, I'll put this statement. You don't even need to put a disclaimer. I'll say that my country abused me, and the United States has wasted me. That's a statement. My country abused me, and the United States has wasted me. None of the two countries is making use of me. But this certificate, if you can go back in 2000, you remember the Ebola epidemic, I was then attached to Mbarara University in what we call the epicenter. Mbarara University had an epicenter. An epicenter is, if I can describe it in terms of I don't know whether I needed to go so much, because Muzukul hasn't introduced himself, but
you should. It's okay.
Yes, and I was working with the Mbarara University, but in a department called Epicenter. Epicenter is more of a surveillance center, a center that does research, a center that does. So when there was an Ebola outbreak, it started in northern Uganda, and of course, the history, where Dr. Lukuya died and others and the nurses. So for us at the Epicenter, I think then systems were very okay. The information about Ebola reached us very fast. Me, how do I get involved? I was in the epicenter department. When you're in surveillance, you basically do collection. Okay, on my side, that was my role, to collect information. So I was placed in the outpatient department. But maybe, how do I survive this disease? I said we were running an epicenter. The epicenter was by WHO, and then Medicines and Frontiers, in relationship with Mbarara University. So that was a state of the art. That's why we didn't lose any staff member, I must say that. And when you look at how the Lokuyas died, this was a new disease. This was a new disease that comes in, and then you find the country not prepared, like now. because so far we already lost a doctor and a midwife, and then we have also about 7 staff members admitted. That tells you a bit of a problem, because you must not lose the fighters first. You must not lose the
Right.
fighters as you lose the patients. So that is how this disease brings me in. That's why I find it important to discuss.
Right.
And for
Thank
now,
you
I
so much.
think
Yeah.
that's the preamble.
Yeah.
Yes, we can
Thank
bring
you
in
so much,
Muzukulu
Mr. Mr.
yes,
Mugeni. I'm going to invite
yes.
Mr. Muzukulu wa Muswangali to tell us about himself and, of course, why he thinks we should be discussing Ebola right now. Should we be discussing Ebola?
Thank you, Henry. Good afternoon, good morning, and good evening, everybody. Those of us who are following us online, it's always lovely to be here. It's a wonderful evening here. And I'm excited, I should say, as always, to be on this space, which enables us, the time to be able to engage in critical issues that concern motherland. I am not a veteran of Ebola, as my friend James, but I'm a concerned citizen. The things that do happen back home, they have a direct effect literally on everybody of us who live in the diaspora, because of those connections that we maintain, by virtue of being Ugandans who are spreading our wings, across the globe. So ultimately, I am not exactly sure whether we could categorize the happenings in Uganda in regards to the Ebola crisis as a crisis, but there is obviously something that deserves our discussion by all means. And I think it's helpful to have medical practitioners, the kinds of James, and we hope that Joel will also be able to join us at some point later on to give us a practical insight into how these sort of things translate into the practical lives of a Ugandan like myself, like yourself. So absolutely we should be discussing that subject. It's a sensitive subject. It concerns the loss of life. It concerns the anxiety that the general public is faced with. I mean, we are just coming back from a very difficult crisis of the COVID kind of situation. So when we have another crisis of the same appearing to be happening amongst ourselves, there is concern and there is worry for so many reasons, that as we shall explore that as we go along the discussion. By way of introduction, Julius Mitala is my name. My background is legal. I prefer to go by my screen name, Mitala Muzukuru wa Mswangali, and I'm looking forward to the discussion, of course, as we always do in this space.
Looking forward to the discussion. Indeed, I think we are all looking forward to this discussion. Dr. Joel Mirembe was supposed to join us earlier. He's still in an emergency, obviously. I hope it's not an Ebola emergency. Unfortunately, he's not here to tell us. But when I heard about the news of Ebola in Uganda, first I thought it was a political joke, because sometimes things are not taken seriously in our motherland, Uganda. But then news about death started coming in. And the reason why I wasn't sure, James is going to join us shortly. The reason why I was kind of confused whether it was really happening or not is because the Minister of Health came out and informed people that you shouldn't worry. I saw a tweet where she was telling Ugandans not to worry about it. There was no Ebola in Kampala. There was no Ebola in Kampala. My friend, what's up with technology? What have you done now? Mr. Mugeni, you're back. You hear? Do you hear us? Do you hear us, Mr. Mugeni? You do, right? Okay. Mitala, you
Wondering
hear me,
what
right?
went wrong. You lost me.
Oh, okay.
My screen darkened.
Just going darkened because you went off.
Yep,
You
it just went off.
yeah, you went off, but now you're back. Do you hear us?
There was somebody from Uganda challenging us that you people in the high tech world hope. I'm hearing you guys very well.
Okay, good. So, like when you left the studio, I was telling my colleague here that at
My
first
loud and clear. Hello.
we do hear you, but you don't hear us. It seems you don't hear me. Mitala, do you hear me? Okay, so James, do you hear me? James, you don't hear me. Which computer are you using?
I'm
The one
hearing you
given.
people very well. I'm hearing you people very well. I'm wondering why.
Okay.
Are you getting me now?
We hear you, but you seem not to hear us. Do you hear me now? Yes? No? Yes? Oh no. Okay, this is interesting. This is going to be interesting.
Perhaps let me try something else. Let me try something else. Let me try something.
Yeah. I was about to ask you whether you're using the computer given to you by the US government or the one you bought yourself. All right, folks who are following us, those who are following us online, thank you so much for following us. You're going to be back in about 40 seconds. Trying to get our friend Mugeni to hear us well. I think we should be listening to each other well. This is the state of the nation. Ibifa Mwanga. We are deliberate, we are reasonable, we are uncensored. The state of the nation with Henry Ssali.
Henry, am I back?
Now you're back, but Dr. Joel, please log in. We are waiting for you. So log in and join us.
Henry, am I back? Am I on?
You're on, yes, you're on. You're on.
Hello?
Do you hear me? Do you hear me?
Hello?
Yes. Do you want to remove
Hello?
your headphones? They're probably the challenge. Mr. Mugeni, how about you try removing your headphones? All right, all right. For other folks who are following us on on this conversation, thank you so much for your patience. Of course, we want to hear each other, so we are trying to ensure that our friend Mr. Mugeni is not left behind. All right, so your internet is kind of right. Okay, and this is America. That is America. That is America. That is America. That's part of America. Sometimes they don't have internet, strong internet, like England and Canada. That's a joke, guys. Anyway, I hope everyone is okay. Of course, I am neither a physician nor a healthcare practitioner, but I am a curious follower of health events or even major events that happen both in Uganda and globally. My colleague, Mr. Mitala Muzukuruwa Muswangali, is also a mental health lawyer. So while he could stand in court and defend or advocate for mental health, for people who are suffering or going through mental health issues. He may not be an authority on other health issues such as Ebola or COVID-19. So other pandemics, for example. We do have an outbreak, as you all know, in Uganda. This outbreak is Ebola. This outbreak is Ebola. Yeah, do you hear us now, Mr.
Hello.
Mugeni? Do you hear us now?
Hello.
Do you hear us now? Yeah, it seems you have abandoned the computer. You prefer the phone now.
Henry, I think it isn't my computer because I have got several people commenting that the network is also poor on their side. I don't know where it is because somebody else who is logging on their end also is not hearing us.
Who is logging on?
I think James is trying maybe to suggest that there is a general network connection, possibly. I mean, from my end, everything seems to be working fine, but we seem to be losing him in and out. I don't know whether that is something.
I'm seated next to the router.
Yeah, I've just checked on some YouTube channels, and they hear us well. But you don't seem to hear us, Mr. Mugeni. What's wrong with your network today?
I don't think it's the router issue. I'm now next to my connection, but the complaint has come from even Uganda.
Who is complaining in Uganda? We are like, when you go on YouTube, tell them to go on YouTube. Follow us on YouTube, listen in on YouTube. The audio is good on YouTube. We have lost about 20 minutes trying to fix this. We need to engage in the conversation, but we cannot engage in a constructive conversation without you, Mr. Mugeni, because you are the expert in this conversation. Fortunately, Mr. Dr. Joel Mirembe has also joined us. Dr. Joel Mirembe, Dr. Joel Mirembe, are you here with us? Are you muted? We don't hear you. Okay, Dr. Mirembe, we don't hear you. Dr. Majegere, Dr. Mirembe, Joel Majegere, we don't hear you.
Henry, the complaint. Henry, it appears it's not my because I've.
Sorry, hope I able to hear me now.
We are able to hear you now. Okay, you had muted yourself.
Okay.
I can hear you.
Not really. My phone was connected on a Bluetooth speaker, so it was the speaker actually.
It was the speaker. Okay.
Yes, just realized
All right. Okay, so thank you so much for joining us. Mr. Mugeni, do you hear us?
Very well, very well.
Okay. Okay, so now we are back. I hope we are back. In this
So, because of the lighting problem, I'm going to switch off my camera.
Yeah, that's right.
Now,
sounds good. Sounds great. That sounds great. Yes, that's good. That's much better.
Sounds great. Yes, that's good. That's much better.
Okay, so Dr. Mirembe, you have you're putting on YouTube. You shouldn't be listening from YouTube. Hello? Oh my God.
Hello?
Okay. Right. Do we hear each other now? Do we hear each other? Evans, thank you so much for that message. Mr. Evans, Mr. Wele Evans, thank you so much for that message. Mr. Maseye Wilrod, you joined us very early in the beginning. So thank you so much for joining us as well.
On my side, I can hear you. On my side, it's okay.
Who has an echo? One of you has an echo. Who is putting on YouTube and also talking in studio?
No, not me at least.
How many?
Not me at least. Because the only app I have open is just a message here.
Yeah, okay. Mr. Mugeni, are you listening on YouTube and also in studio? Yes, no? All right. Dr. Mirembe, tell us about what is happening in Uganda. Tell us about what is happening in Uganda. We've lost about half an hour. But why don't you tell us what is happening in Uganda?
I don't know where the echo is coming from. But anyway, I'm good to go. I think I've deactivated all the apps. But what's happening in Uganda currently? I would want to start by greeting our listeners and viewers. In Uganda, we are saying good evening according to Muzungu setting. Tuli mu budde bwa kawungeezi fenga abasajja abaddugavu era abaganda budde bwa kawungeezi lw'egguloggulo. Ssali nyirowooza n'atubulira essaawa zino baziyita batya mu lulimi Oluganda olutuufu. Erinnya n'eddoboozi nze Dr. Mirembe Joel. I'm the chairperson oba president wa Central Uganda branch of the Uganda Medical Association. I'm also a health equity activist. Also a political activist in one way or the other. I'm very concerned about what's happening in my country, especially in terms of the leadership at all levels, from the village, and I mean actually from the households that we have to the state house, and of course the surrounding countries. So as a political activist and as well a medical doctor by profession, I'm actually doing a master's at Makerere University in the same field. So we are currently faced with so many challenges as a country. And of course now Ebola seems to be on the lips of everyone, as if it's the only problem this country is facing. It's natural. Maybe it's not about even a government or people in a government currently for an outbreak of Ebola, because an outbreak of any disease can happen in any country, especially for these diseases. But the question would be the response of the people. And when I say the people, I mean the representative of the people they elected to be in particular offices to offer services. So before I go to that issue of leadership, I want to give an update of what exactly is in the country regarding an outbreak of Ebola, since it's a topic that we are going to discuss today that panelists have deliberated on already before actually I joined. It's unfortunate that I wasn't able to get what has already been said, so I risk making a repetition of some of them. But nevertheless, kindly, I apologize for signing in late, and I request that you allow me give the update that I have. So Henry, we have an outbreak that was declared at the start of this month, the last month. And so far, we have fatalities, and the most prominent, at least we have a child who has died, at least we have a senior doctor who has died, who was also doing his master's. And this is a colleague who came in from a neighboring country, Tanzania, to come and add on more books at Kampala International University. Usually by ethical standards, we're not supposed to say people's names. But unfortunately, this was already said by the Minister of Health to the public. It was said to all over, it's all over. I'm sure all of you know. Dr. Ali Muhammad died of Ebola here in Uganda. So for people who were on ground, tell us, before actually the outbreak was declared, certain patient came in when he was bleeding and these other symptoms that relate to Ebola. But like you know, Ebola has symptoms that are similar to so many other diseases. So the first sight, people thought maybe this person has internal bleeding and needs to be rescued. So in a very resource limited setting, with less protection to these colleagues, they saw the patient, this team went in for a surgery to save this patient. So this patient findings I'm not at liberty to disclose by ethical standards, but there was the known causes of internal bleeding. So later the patient was further investigated to see exactly what's the problem and discovered that had Ebola. So now, what was clear that these colleagues, one, had contact with the patient, two, they knew very well they didn't have enough protection in the case of such a very dangerous disease. Because they went in to save this bleeding patient. Anyway, if they had not gone in, the patient would die. If the cause of the death was the bleeding. So they went in, and since my training from medical school, people have always gone in to save people who are bleeding with the less protection. And we live when we have blood splashes, when we have fluids from that particular patient. Because the general practice in the government hospitals, there is not that state of the art protection for the whole health worker. And in so many cases, you have to weigh between the life of this person, and if you see the risk is not very big, especially that there was an outbreak of Ebola then, you can't save this soul, because as a humanitarian, by nature, by the environment of practice, all doctors are humanitarian, and those who are not, probably they're not supposed to be. All health workers literally are meant to be humanitarians. Mr. Mugeni here will testify to me. But being a humanitarian does not qualify us to be sacrificed all the time. Does not qualify us to be subjected to conditions that stop us from enjoying a life other people are enjoying. Our children need to go to school. We need to also have good houses, drive good cars, do a lot of things. I don't know why some echo came in, but anyway, the story is Ebola is in Uganda, according to reports from Ministry of Health. We have confirmed it by death of one of us, father. So for the listeners, what I would say, if you are in Uganda, you have a relative in Uganda, tell them to take precautions to ensure they don't get the disease. So since I'm a doctor, let me also give a few medical information that is necessary for the general public and viewers here about Ebola. So Ebola is a disease caused by a virus, and several of the virus in this case has many viruses. For example, the current outbreak, according to Uganda Virus Research Institute, is from Sudan Ebola virus. There is another one, Congo. There are very many others. They are then strains of those individual viruses. So now, and each of them has differences in biological composition, biological makeup, and the pathogenicity or its ability to destroy, to cause disease, and the severity of the disease. So what we have from the recent symptoms, you realize actually, of the many cases that have been confirmed when they are still alive, you realize they didn't have, very few have this severe bleeding. Some people call it Ebola hemorrhagic fever. And that name has been withdrawn. It's now called Ebola virus disease because many people contract now the disease and actually they don't have the bleeding. The bleeding usually comes later at the worst stages of the disease. You have seen that the Minister of Health at some point about 2 days ago reported that of the people who contracted the disease at the start, 2 have recovered from the symptoms of the disease. It's also important to note that this disease doesn't have a cure because there are very many viruses that cause it. Some vaccines for preventive measures have been developed, but I can tell you
you seem to be muted, Dr. Mirembe. We are missing the latter part of your comments. I wonder if you do hear us. Please let us know if you do hear us. I think you're providing very important information that Ugandans should be utilizing to keep themselves safe. So please, when you hear me, kindly reiterate some of the conversations that you have been providing. In the meantime, I'm going to invite my friend, Mr. William Mugeni. Not sure if you have been hearing everything that Dr. Mirembe has been talking about, but if you have, what are your thoughts regarding what's happening in Uganda? Specifically, how the fighters should be protected. When I say the fighters, I mean the medical personnel, the medics, the doctors, the midwives, the nurses, those who are taking care of our sick. How should they be protected? Because you talked about protecting the fighters. Dr. Mirembe has also talked about the same and the culture in Ugandan hospitals of not taking good care of our doctors and nurses in terms of providing protective material in the midst of fighting these diseases. Mr. Mugeni, what are your thoughts?
Well, I heard Dr. Mirembe very well, and I think I lost him in his last comments, but I'll start off with just a key point I want to mention that I don't want us to miss, that medicine is nothing but politics. Good politics is good medicine. Then I will also come in and say something why we should be concerned, especially we who are in the diaspora. We in the diaspora, I think, Canada, where you are, you're seeing state-of-art facilities. The US, where I am, I'm seeing the state-of-art facilities. I just want to mention as a quick one that the hospital where I am, we have 800 staff. 800, and the hospital never lost a staff member to COVID-19. Although we contracted COVID-19, I got COVID-19 and several people also got COVID-19, but the hospital where I am, we didn't lose anyone because of the infection control methods and the care that is there. But that said, I think like my preamble, I told you that I'm a certified Ebola expert. not necessarily an expert, but one who is in the database of WHO. At least I am certain I was trained not by Mulago, not by Barayama, but by WHO. And we were basically reserved for the future. They said in case in the near future we'll be calling upon you. And nobody has ever called upon me, maybe because I was never paid. That's something I want also to emphasize. Just because I was never paid, maybe because I made a lot of noise during the Ebola 2000, and that rubbed people in Ministry of Health and they started isolating me. Yes, Dr. Mirembe, I think so far we have a doctor dead, and he's from Tanzania. I was having a rough conversation with the people yesterday. I said, after all, maybe he's a Tanzanian. We don't care as Ugandans. Dr. Mirembe, I'll come in. You are talking about for activism. Dr. Mirembe, my record is sure that ever since I stepped in health, I have never kept quiet. And yesterday we had a Zoom, of which we even hired the doctors, I mean the team from Uganda discussing with us. And they're telling us they don't have the necessary items, or whatever you call it, the PPE to fight, to be on the front line. They don't have it. And you are talking of a country that has just had an epidemic. Dr. Mirembe, at some time I'll be sharing with you the facilities that we have. And I've been telling USA that for now, I think we managed to get the facilities because they discovered before COVID, during COVID-19, that we didn't have primary health care centers. So almost every, I would call it every district or every village has now a walk-in clinic. But I was telling America that yes, you have created the walk-in clinics, but the costs. I went to one of the walk-in clinics and I regret why I went there. They hit me with a very hard bill that I can't pay. But that said, I am just trying to inform that Uganda has had a series of diseases from Ebola, went to COVID-19, and we've had even several fevers, swine fevers, I think, remember. By now, our response should be instant. By now, our response should be good. Because you're talking about James who is now on the shelves, not even thinking of when he will ever be used. Then perhaps the COVID-19 team, it's not so easy to get people who can stand in terms of an infectious disease. And if I can remember the 2000 epidemic, I was on the surveillance team. And surveillance were basically people who would go and map the disease where it is. If they mention that, yes, we have somebody bleeding in this village, we would run there to take histories and what have you, and then see how to evacuate that person to an isolation center. Now, I remember we would literally go escorted by the UPDF. Personally, I was questioning that, why are we using the army? But then the scare that Ebola causes, this brings in Muzukulu, the scare that Ebola causes, once somebody is admitted, it's almost similar to COVID. Once you're admitted, you are sure your relatives will never see you. But then at that time, it was kind of new. So the world was more scared. Then it was a very tough time for some of us because I remember being isolated from my family for 30 days. And then when I went home, because we created a center for staff members where to live, those who I believe to have had contacts. And for me, like I said, my contact was not even that. It's just saw a patient bleeding and being in outpatient department, I just admitted my stitching. And when the patient went to the wards, that's where chaos began. He infected almost everybody who was on that ward and people started dying. And then that's when we discovered it was Ebola. But then we had a good epicenter, a center that was called Epicenter, which was run by Medicine Sans Frontiers and WHO and Para University. And that's where I was working. So Uganda, so far, who have had a lot of epidemics that by now you should be having one of the best teams. We are supported by World Health Organization. We are supported by CDC. Because right now, when you look at CDC has already set alerts, and they're saying they're working with laboratories and not have you to set mechanisms in place. But getting this being replicated in the country is another difficult thing. It's what you don't understand. It's like disease has become a way of life, a way of business for others, and they forget the frontliner. The frontliner. You know, when you say a doctor has died, a midwife has died, that puts a lot of question marks on the system that you are using. How are you managing infection? Because necessarily the doctor is not supposed to die because he knows how to handle an infectious patient. At any one time, right now, we are conscious because of COVID-19. It's still existing. So by the time somebody who comes in with COVID-19 in the hospital, perhaps you have a mask on. Perhaps you have, and if you're an examining doctor, particularly, you must be having the PPE on with you. So you wonder, where did it go wrong? And a Tanzanian dying, I was telling my colleagues yesterday on the wall that some of these things I think are good so that our regional neighbors should start minding about us. Our regional neighbors should start minding about us, because what happens in Uganda seems to be a Ugandan thing. Nobody cares. Nobody cares. Then we're talking about a disease that can, when we say Uganda is an epicenter, it's like an earthquake. It starts from that place and will spread across the whole world. But you're wondering why the world is cold. And that's why I said it is so important for us to get engaged in it, because me and you who are talking are Ugandans. I'm in America, but I have my whole clan right in Uganda. So us talking about it, you require that the other health bodies and partners give Uganda attention. The complaints that Ugandans raise are so disheartening. It's like we're an isolated group of people. From still the public health point of view, when you look at the information that is going out there from the public, Dr. Mirembe, you're on the ground, but I'm now giving information that comes from one of the bloggers, a popular person. That would make you question that, what does surveillance in Uganda mean? Because what you call non-starters or non-medics, we are talking about patients who are brought from Congo. Dr. Mirembe, you know that one of the ways of fighting a disease is to fight myths. You must fight. But the bloggers were talking about this disease, and perhaps Dr. Mirembe, you and the Ministry of Health and others people were not caring. Well, they don't even care. But they said it, that ambulances carried patients from Congo to Mugeni. No, Mr. Mirembe, doctor, that is a myth, very strong myth. If you are fighting a disease, that you need to dispel with authority. So who is our authority in this? Remember, fighting a disease, you need the political will, you need intersectoral collaboration, you need community participation and involvement and appropriate technology. Now the community has it that ambulances ferried in patients from Congo. With what purpose? Henry, that's the question that I'll leave for Dr. Mirembe, who should be now fighting, who is on the, maybe if he has had that rumor, because for him to fight the disease, I'm speaking of that rumor from USA.
Right.
And Dr. Mirembe, me and you, we are authorities. So I'm not picking it from, yes. Thank you. Thank you, Henry.
Thank you so much, Mr. Mugeni, always coming with very intriguing questions. Dr. Mirembe is temporarily off, but will be joining us shortly. Mr. Mitala, as a citizen, based on what you have heard from the two medics, your thoughts as a regular citizen?
Yes, thank you very much, Henry, and thanks to both James and Joel for providing that, very, absolutely insightful, overview into, what we are exactly experiencing. For me, really, this is a question of what is our public health strategy as a country. If when you think about the role of government, what is the role of government? Among other things, the government one of its role is provide good services to the population, health, education, security, employment, and stuff like that. That's one of the roles. So this is it's a key domain of what is the role of our public health officials. What is our public health strategy, really? That's the question I should be asking myself. But then I always like to ask myself those kind of questions, because they help kind of provide some kind of background on how you could be approaching issues of such a kind. But before we even go into that, there are things that I've been thinking about as James and Joel have been discussing this matter, and certain things came to my mind naturally because of the nature of my work and my training and all the other things that come into play. So there are things I want to the public to understand very well, because when you talk about the crisis that we are having, we are looking at it from possibly three perspectives. The questions that I'm asking is are we dealing with a pandemic? Are we dealing with an epidemic? Are we dealing with an endemic? Those words, they tend to be used quite interchangeably in the medical world. Now, ultimately, my background is not medicine whatsoever. I happen to be an advocate, a practitioner in the world of law, but from a completely different perspective. But I have a little bit of an insight into some of these things, and this is why I really want the public to be able to understand that what is it that we are dealing with. Is it a pandemic? A pandemic is something of a global nature. The sort of thing that we have seen on COVID is the best example that I can give, has affected literally everybody in the world. So it's a pandemic. It's widespread. Its spread is quite catastrophic. And then the secondary issue is: are we dealing with an epidemic, something that is more spread across more than one region? Possibly, it's a threat. It's a serious public threat, and the number of infections are rising quickly. And then the third category of that then becomes an endemic, something that is kind of common within a specific category of people, within a specific set of people. So it's like a normal, for that subcategory of people. So we have had Ebola before. This is not the first time we are experiencing Ebola. I think this thing first emerged on the world scene in 1976, as far as I understand. And I think from all the instances when we've been faced with this crisis, I think we've had quite a lot of support, as we usually do have support from various stakeholders, from the World Health Organization, from all those, support from different countries, the US, whatever, all the well wishers. They always step in, to provide the resources, to be able to help, those who are dealing with the crisis to be able to deal with it, effectively. Now, the problem is that in spite what we know already, because as I said, we are not dealing with a completely new situation. When COVID came around, you could forgive people for having been caught unaware. Everybody was in a new territory. Nobody knew what to do. Now, when we talk about things like Ebola, we are talking about tuberculosis, these 7 killer diseases, whooping cough, blah, blah. This thing has been around. There really has to be a strategy. This is not something that should be getting us by surprise. So the question is that, what are the priorities of our public health policy? For me, that's really would be the question that I would be, asking, because the responses that officials come up with and how society responds, when these sorts of things do emerge, is kind of related to the questions that I've asked above. That what are we dealing with? Is it a pandemic? Is it an epidemic? Is it an endemic kind of crisis? Because because the situation has been with us before, I suspect that the general public is not so scared anymore, because maybe the public has grown. They have kind of gotten used to it. When you mention Ebola, people do not panic because they think this is something we've seen before. Maybe we are able to contain it. But on the contrary, it doesn't look like it's being contained, because as Joel was saying, and again I read somewhere in the press that the problem began to emerge somewhere in August, and it's only becoming a national crisis towards the end of September, almost a month down the road, and it doesn't seem to be like a proper kind of system has been put in place by those who are concerned with this kind of issue to be able to address the problem. Because if measures had been taken at an earliest stage, take away this laxity and this, Ugandans, we seem to be a bit careless. And when I say we are careless, it kind of it encompasses almost everyone. If you've been to a Ugandan hospital, you can tell, the recklessness with which people deal with people's lives. You end up in a hospital and people seem to be much more concerned with you having a medical insurance, you to produce a card. It's a life-threatening kind of situation. Somebody is on the brink of death, but people seem to be much more interested in the health card, that health insurance card, than dealing to the problem that could potentially save somebody's life. So there is lots of issues around there. So the question for me is, what are our public health policy priorities? What are they really? Because that's really the key question. I would possibly be focusing on. And to answer that question for myself, without even going very far, I think our priorities should be: number one, reducing hospitalization; number two, reducing deaths, the number of deaths as much as possible; and number three, minimizing the impact, the social and economic impact that emerges from a disruption when we've got a crisis of such a nature. Because what you tend to see is that people begin to take children out of school, people avoid going to public places, the economy gets affected in that kind of situation. So the measures, whatever is being done, should be geared towards making sure that we minimize the effect in those areas. But I think I am very sympathetic, and I can hear the voice of both James and Joel. Everybody who works in a clinical setting, their first motivation, much more than anything else, their first motivation is to care for people. But obviously, in the business of caring for people, there's a real risk that sometimes you can pay the ultimate price, and the ultimate price will be with your life. And in my experience, what I've come to learn is that, when you are, regardless of how big or how experienced or how expatriate you might be in a particular situation, when you are dead, when you are not there anymore, the world moves on. It's like nothing has happened. They'll replace you with somebody. There's always somebody to replace you. So certainly, yes, the clinicians, people who are working at the front line, they really have a legitimate concern that they should be protected properly, they should be facilitated, they should be protected, they should be motivated. It's really a point of concern that those who are responsible or who are in charge of our public health policies, they don't seem to be having these considerations at the back of their mind when we are dealing with crises of such nature. Because otherwise, how are you going to mobilize the resources? How are you going to mobilize these young men and women, the doctors, the nurses, the laboratory technicians, and all those people, amidst the worries that they have themselves, and especially when they are seeing colleagues not dropping down dead, but the motivation and the assurance is not coming from where it needs to be coming from. I think that's really a matter that's very, very concerning. So I think the strategy should be communicated very clearly. People should be, the public should be able to see the logic of the decisions that are being made and why those decisions are being made and why are they important. I think somebody needs to come out and explain to the public in clear terms that this is the strategy, and those who are doing the explaining must show some empathy towards the public. I saw a situation where people escaped from these isolation centers. You really have to question yourself, what motivates a patient? I mean, if you've been taken to a place for treatment, what motivates somebody to escape, from that place? Because I believe that you would have been taken there for your own benefit, or at least for the benefit of the general public.
Very
But
good questions.
yeah,
Very
but
good
what
questions.
motivates a patient who very well knows that possibly their life is at risk, but they are prepared to take that extra effort, to escape from a facility where they should be getting assistance from.
Right.
We
This is the state of the nation. Irifa Mwanga. We are deliberate, we are reasonable, we are uncensored. The state of the nation with Henry Ssali. Welcome back. And with that,
Henry,
thank you so much,
I just
Mr.
wanted
Mitala.
to ask,
Yeah.
I wanted to ask a question. It will be a question to Dr. Mirembe, and because
Dr.
it's still
Mirembe.
about the myths about surrounding the movement. Yeah, I saw him back, and I wanted to make sure, because the public opinion is so important. It is so hurting. I mean, at my level, if I'm getting this information, how much more is it difficult for the Dr. Mirembes who are on the ground? And how do we heal a country of such? Because the doctor who has died, Dr. Mirembe, yes, we agree. You said, okay, definitely his privacy has been overexposed. That still goes to medical practice. But then Ugandans, even if it is one Ugandan who sits and passes information that the doctor who is dead perhaps is not even a Tanzanian. Dr. Mirembe, look at that. That the doctor who has died, Dr. Mirembe, you, if you died, you are a non-entity. Nobody cares. After all, it's a Ugandan, it's a Dr. Mirembe. But it is moving social media, and you want to stop, and that's the power of that. Now information doesn't stay. The rumor runs faster than the truth now. Now, the rumor is the dead doctor, Rip, is being brought forward such that it can have world attention, because our citizens now believe having diseases in Uganda or an epidemic is a form of income generating for the country. So if you're dealing with such, and you're at the front line, Dr. Mirembe, what do you say about that? And of course, so far, this is Ebola is more of an endemic disease. It has stayed. It's there. It's in Congo. It's in Uganda. It's in Congo. It's in Sudan. But just because of the movement of Ugandans, either soldiers, business people, you easily catch infectious diseases, bring them back home. So, Dr. Mirembe, my question, as it stands, we have a dead colleague, but the world is spinning it around. That is made by Uganda. I want you to dwell on that a little, and I see how that works for you, for your effort in fighting Ebola. Thank you.
Yeah, Dr. Mirembe is currently having challenges with the internet, but he's back. Of course, you posed a question to him.
Yes, I am back.
Did you hear the question?
I didn't hear the question, but I pray my internet doesn't disrupt me again, because I will feel bad that being interrupted, just keeps going off for unknown reasons. Yet data is there and everything. So can I get the question before I start to submit?
Mr. Mugeni, in 1 second, rephrase your question.
Dr. Mirembe, the myths surrounding Ebola in Mirembe or Ebola in Uganda. Yes, right now we have a doctor who is dead, and you have the myth. The myth is the doctor who is dead is used as a PR stunt. That Uganda was somebody foreign sound. Because if Dr. Mirembe, you died, you're a Uganda, nobody would care. Now we are trying to buy into something else that let's use a Tanzanian. And that's a myth out there. And so I'm like, as a challenge to you who is at the front line, how do you address such? Thank you.
Okay, thank you very much, Henry. I will answer that question. It's important that it's answered in context and answered in the right way.
Right.
But before I go that, at least I've been on and off when internet is disturbing, but I had several submissions from Comrade Mitala and of course Comrade Mugeni. So you see, I come on this show when I have several shows to put on. Myself as an individual, my opinions, my statements about people who lead, in fact, who rule us here. Then I come in perspective of a doctor, and at that point, a leader of doctors at the national level in the Uganda Medical Association, leading an entire branch. Mirembe is almost Kampala metropolitan. And I've taken efforts before I make my submissions to get to people who are on ground in Mirembe, who are there, who ran away, who are there in a particular. I'm talking about health workers, not any other person at different levels. And I can tell you, I've got several information that comes from the unofficial channels, and that's what probably sometimes we are bound not to publish because of protection of the sources, and at the same time, because of what the public may perceive it, given the fact that some of us, we are sworn enemies of the regime. So now, on the issue of Mr. Mugeni, really I wanted to first submit but let me first answer it before internet disrupts me. One, that is something I'm not going to repeat, but I can tell the causes of myth. Henry, people lost trust in the current government. To the extent that even if this government comes up with a very good thing, we shall reject it. Probably I will be one of those people. So I don't blame those who don't easily trust anything, even when it's from technical wings of this regime. But for the fact, people have alleged that Ebola now was declared in Mirembe to further displace people from the gold areas, such that the regime apologists and its acquaintances can mine gold without disturbance. People have alleged
several gold or oil. Is it oil or gold?
Mirembe has gold.
Oh, okay.
Gold has a lot of gold areas.
Yeah.
It's not about the oil this time, but also the oil, of course, maybe, depending on how you see the geography. But now, for the case of Ebola, from the colleagues I've talked about this, I think when I was starting before internet disrupted me, I was sharing how these colleagues got into this case. And some of them, they are still sick, and some of them have worsened. In fact, these people don't have access to ICU, yet some of them are in a state of needing ICU. But it's funny that government has not made provisions to transfer ICU equipment to the centers where they are in Fort Portal for treatment. So Ebola, the outbreak is there, colleagues have infected, more than 8 of them now. These include nurses, anesthetic officers, those are the guys who give anesthesia in theater. There are doctors.
Are we losing Dr. Mirembe again?
I'm now being heard, right?
Yes, we hear you.
Are you guys hearing me?
Yes.
Henry?
Yes, we do hear you.
Are you hearing me?
Yes, we can hear you very well. We can hear you very well, Joel. Yeah, go ahead.
Yes,
Are you hearing
I'm
me
hearing
now?
you.
We do
Okay,
hear
thank you very much.
Yeah.
So the outbreak exists.
No, we don't. All right.
I hope this is not a case of sabotage, deliberate
I
sabotage.
know, right? I hope it's not. I was just about to say that actually. So, yeah, that's the challenge of disseminating important information. Sometimes you will get disrupted, either deliberately or implicitly. But James, you have heard. I'm not sure if your question has been answered. Who is sabotaging you, Dr. Mirembe? Who is sabotaging you?
It is the internet. I don't know why. For one
Is it-
reasons, the internet has chosen to be very funny. I don't know who is really breaking into my internet connection, but just because of when you see it is on, but it's not working. I'm not
Right.
using like a mobile at that cost, so I'm buying my authentic data, but I don't know why.
Okay.
So I was still submitting that the epidemic, the outbreak exists, and several people are in it. The regime can choose to exaggerate the numbers. I am not able to protect them on that, and I'm not protecting them in any case, but I'm just stating the facts as they are. So for an outbreak like this government would have been very well prepared, because it's not the first time, it's not the last. There is good medical, technical, political, policy information, knowledge available across the world. And this disease has been here since the 70s. And several strains, viruses have been discovered. But it is unfortunate that now almost a month of an official declaration of an outbreak, and the frontline worker gets infected, they need ICU, and actually they can't access it. Yet it is said there are several ICU equipment stored in some stores at national medical stores, stored in stores at regional referrals. They are not functional because they don't have staff to take care of them. After all, people who worked in COVID were rewarded by being chased from their jobs when the COVID epidemic ended. People were not employed. So several calls that are informed have been made for us, actually, Uganda Medical Association, to mobilize health workers for them to go there. But people are hesitant because they are alive the fact that some families don't have a mother and a father because they died while working in COVID treatment centers. Those families have not been taken care of. Their children are suffering. Their mothers, their parents were depending on them. They are all in this area because their loved ones died in that. We have children who were left without fathers. Their fathers died, and they were born when their fathers died because they are health workers. So people are very skeptical, by the way, Henry. And I can tell you a score of numbers of health workers have run away from Mugeni, Ebola treatment unit. Yes, my friend Mitala was asking, why should someone run away from a treatment unit? My friend, if you are in a treatment unit and you spend 2 days without being attended to, so so there are issues that are structural. infrastructure, leadership, the human resource there, is it enough? Is it protected anyway to go there? Because there are those ones probably who are there, but they even fear to enter the treatment units because they feel they are not protected enough to survive while trying to save others. So the question is, why risk to go there to die? When you see your colleagues are there yearning for treatment, it is informally reported that actually some of these colleagues who are admitted, they are treating themselves. No one is entering those units in the normal times. People are seeing them once a day. These are people who are supposed to be monitored closely every 4 hours at least. They should be seen by a doctor. So there is a lot of trouble. There is a lot of leadership problems. There is a lot of technical problem in handling this very fatal disease. Of course, some of it stems from the fact that the disease is very fatal. So people don't want actually to even work in these units. But how does that come up? Mugeni was telling us here how they didn't lose the health work to COVID in their unit. Because people were protected initially. People, the hospital reassured people of security. But I can tell you, Henry, currently, you cannot take me to Ebola. How much money you're giving me? Because I know I am going there as a sacrificial lamb. I'm being sent by people who are not committed to protect me, to protect even these people I'm going to treat. They are sending me for political reasons to just go on media and say, we sent 100 doctors to Mirembe. I'm just using that as a number. We sent 10 doctors to Mirembe, these nurses and all that. And then that ends there. The budgets, the corruption is, you see, there are very many now dogs waiting for the Ebola budget to come out, and they will devour the budget, eat up everything, while letting the patients, the frontliners, from the cleaners, you get, to the doctors level. Guys, it is said some of the health workers are hungry. No one is taking them food. Same is to the patients. So this government, for those who are watching, please tell this government some things don't need politicization. Of course, I'm alive to the fact that one of the senior founders of medicine at one point has stated that medicine is nothing else but politics at a large scale. That is virtual. So the politics at this time should be aimed at making sure we stop the spread of Ebola. 2, ensuring those who are infected are given all the needed care to survive. Ensuring that the health workers are assured they are protected, they have job security, they have family security in case they lose the battle to Ebola, because this is clear records. At least we buried 20 doctors in Ebola. Sorry, in COVID. 20, including very young, brilliant men. Some had just gotten married, not even children, and they produced. They died. The records are clear. We have them in our books at the Uganda Medical Association. So, with the colleagues aware and alive to such information, if you were the one, would you go in for a government which wants only to say they deployed you and then they forget about you? And then you will hear, now just go to Ministry of Health and the other government agencies and know the allowances being shared per day in meetings. But they don't want to comment about allowances, risk allowances, and hazard allowances for health workers who are already in Ebola treatment unit. They don't want to commit about that. But for them, they are earning allowances of 50, 500,000 per day. People are giving them per diems to that tune. You get? So there is a lot that is not answered. There are a lot of questions that don't have answers. So internet has been disturbing, but I had prepared really to speak, but I've decided to just speak a few things here and there so that by the time it disturbs me, I've made some submissions. So
I know, and these are very
the question is, what is the way forward for this country? What's the offer for this country? You say Ebola is here, another disease is going to come because diseases are not going to end. It's natural that diseases will come. But the response of a government, the response of a population to such diseases is what this internet has again started
I
to
know. Yeah, don't worry
be
about
mean
it.
on me. But I will continue until when whatever happens. So that's the question. What is the role of a government in such a situation? Is it to do PR, make press statements, or actually to do work that the worker will make press appearances for itself? You get? There is way this government should start doing work that makes news for itself. Now, Henry, the head of state, in fact, the chairman of NRM, because that's what I refer to him for me at a personal level. The chairman of NRM made an address of how many hours? Over, I think, 2 hours. Henry likes listening to him, but me, I'm that guy who doesn't want to listen to him because he never says anything new except the threatening us with the being able to manage us, kill us, and other things. There's nothing new. Taina cha gamba gwanga. Tell me, Henry, 2 things he said about how we're going to handle Ebola. Just tell me one thing. You are a person who is in media, you follow these things. Mitala, tell me a headline he made in a New Vision, which is a government leading paper. Tell about this particular outbreak. After being quiet for very many days and trying to read around Ebola, coming and talk about the pathophysiology, how Ebola evolves, spread. Is it his mandate to talk about that? Or it is people didn't give him a mandate to begin teaching us about diseases because they are doctors. The Ministry of Health has a Director General of Health Services whose work is to lead the technical wing of that ministry. It is him to be discussing that. The president is supposed to come up with the solutions that are leadership, management, you get? Resources, where are they coming from? How are we remunerating our health workers? How are we making sure we're not spreading the Ebola to Kampala, which on a daytime, it has a population which goes even up to 6 million. And in the night, it is lower to about 2 million. How are we making sure it doesn't spread the rest of the district? Those are things he's supposed to be talking about. Did he mention them? So the problem, Henry, is in the head. Fish rot in the head. And as long as the head continues to be rotten, expect more of the same. Expect nothing but more of the same, or even worse than where we are.
Right.
We are in pain, Henry. We are frustrated as people who live in this country. Frustrated in all angles. And I can tell you, we are on prayers. We are seeking now knowledge, wisdom from the above, such that we can be able to maneuver these situations when we are alive, such that we can be able to bring leadership that works for the people when we are alive. And I want to use this opportunity, because I use every opportunity I get, to rule you colleagues, yet you already converted, that wherever you are, please try to lobby, try to just lobby for Uganda, and it will do one thing. I'm not saying go to the streets and protest in the US. Probably that will not remove Museveni. I'm trying to say make networks that will be able to build what will remove Museveni here. I'm sure you guys want to come back when there is a better country here. I'm sure you guys love to stay in Uganda more than to stay where you are. Because this is where your childhood friends are. This is where your parents, your ancestors, and everyone is buried. You get? I'm sure that actually this country.
Yeah, we have lost Dr. Mirembe. He will be joining us shortly, but everyone who is listening to us, who is following us, could hear the heart in his in his submission. Every one of you, I'm sure, can relate to the frustration that Dr. Mirembe is sharing with us here today. Of course, he asked me what Mr. Museveni said. He said a lot of things, but I think one was very important, especially in regard to Ebola, is that airborne. It's not an airborne disease. It's not corona. It's not an airborne disease, and therefore it does not spread like Ebola. So he will not be closing down all the markets or the schools or the worship places. Of course, according to Dr. Mirembe, we shouldn't be lectured about that. Mr. Museveni or President Museveni is not supposed to be teaching. There are other people who should be more qualified to teach us about Ebola. And what he needs to do is provide leadership on how to approach this disease, and of course how to ensure that no more people die from such diseases that have been here for decades, sometimes longer than the coronavirus. The issue of money has been talked about, and how people are just benefiting from part-times when they attend meetings. Of course, I do not have evidence to that, but people who are on the ground probably know friends who have been attending these meetings and could be speaking authoritatively about them. The issue of hiding or keeping equipment in areas where they shouldn't be at this moment, because there are no physicians or doctors or medics who are willing to work on them or in those areas for fear of their own lives, of course. These are all important conversations to engage with. Dr. Mirembe, welcome back. Do you want to finish up in 30 seconds so that Mr. Mitala can respond to you, and then Mr. Mugeni also can provide some insights based on what you're sharing today?
Yes, thank you. Yeah. Thank you. Now, I just want to away from that, I want to just to let this platform and our viewers know. Recently, yesterday, Uganda Medical Association National Executive Committee issued a statement. The statement about was the same Ebola outbreak. Of course, a colleague died, and not only a colleague died, but more colleagues were critically ill with the disease. But like the gaps I've mentioned, those very gaps are also affecting them. They're not only affecting the common people who are in isolation centers, then who are in treatment unit, but they're also affecting the very people who were treating others and they contracted the disease. Those colleagues, for example, healthcare has its own challenges, especially in human resource. As we work, we always have people who are training. We always have people who have finished, but they are just fresh graduates, so they don't have that experience that sometimes is needed, but they are acquiring it. So some of these people, the intern doctors, they are graduates. They have their degrees. They graduate from their universities. You get? They qualified. But they are now the very people who receive the first doctor to see you when you go to these government hospitals, especially regional referrals. It's an intern doctor. So, and you realize many of them actually in the isolation unit, and it is about 2 of them who actually sick. But it is sad when their families hear that government cannot bring them the state-of-the-art health care that they were sent to offer to the people. You see, Henry, I've been leading a fundraising the last 12 days of a colleague called Dr. Stephen Sewamba. I think you have been knowing about it.
Yeah.
The reason why I was leading the fundraising was because this guy works on a sickle cell unit. He's also a sickle cell patient. And he's a volunteer there. Government doesn't pay him. Now, this guy got a complication of sickle cell in a hospital where he was working. My friend, this hospital could not offer him a service he needed. This guy needed implants in his bones. such that he can quack again. This guy is the hope of his mother because his father died. I looked at his situation and everything. Oh my God. I'm like, I can tell you I've sent information, engagements. I've sent people to the office of the Prime Minister on this issue. I sent people to Parliament on this issue, including the Member of Parliament presenting on the floor of Parliament. I can officially tell you, I have not received even 100 shilling from these government agencies on this case of someone who is volunteering in their hospitals. But I have at least received 23.9 million from well-wishers. And our target is 3 million. So that example classically illustrates what is in the Ebola treatment unit. I think now that there are doubts about Ebola, let us use the example that is living. I know Stephen. It is me who is the chairperson of the fundraising committee. It's me who has been leading the fundraising. Now you can see, people cannot access the care they give in this country. And the government is not minding. These guys are not priority. These guys, you want to send them in an Ebola epicenter. These guys, when their children are still 10 years, 5 years, some are not yet born like mine. Now you want to take me to an Ebola treatment unit. My mother, I'm the hope of my mother down there in the village. I'm the hope of my siblings down there in the village. They're looking at me. Their school fees and everything is coming from me. Now you want me to send me to an Ebola treatment unit, such that I can also die, such that more people will be in poverty, more people will want to go to school, such that more families will be orphaned. When for you are talking about allowances. Henry, you were such a good one at that. Please find out the per diem rates of officials, the commissioners at the Ministry of Health. Leave these people who go in the field, these pitch at that ministry or any other government ministry. These so-called high-level ministerial meetings that are held every day almost. Find out and you will know how people reap, how people steal with impunity. That is stealing, because people are paid to do this work. They have these meetings at the very ministry where they work. Not that these meetings even are for travel. Guy comes in the morning, checks in with his security details, goes in his boardroom where he works, begins to have a meeting, and then allocates per diem. Begins to have a meeting and allocates per diem. They're about to begin when he, for example, Henry goes to consult at a ministry in an office, they're about to even make it per diem. Those are the things we are talking about. They need to end. You get? They need to end. The government needs to restructure to a functional small unit. Currently, very many offices, but I can tell you very little or no output at some point. So, kati tukole tutya. Tukole tutya. So those are the issues. Uganda Medical Association has been saying that the interns should be evaluated, isolated for a month, and then it just at the end of the month, then it report to other hospitals. But when Ebola goes to those other hospitals, what will happen? People must first be reassured of their security when they are working, because we saw to work, we saw to save life, and we are interested, we are willing, we are ready to go, as long as there are systems that are going to protect us. And in the case of the bad outcome about our life, the people we leave behind, our families, we need to be assured they are going to be protected.
Right.
COVID-19 health workers who died, the doctor, 20 doctors and several other health workers, over 50 others, their families have never been compensated, Henry. They died in line of duty. Henry, there is no doctor in this country who gets sick and has an insurance from this government. UPDF soldiers, even corporals, have insurance. I've been treating them at the Victoria Hospital, where I previously worked. So you're telling me you have an insurance scheme for soldiers who are there in their barracks chilling. Then you don't have an insurance scheme for me who every day goes out there to save, to work, to relieve pain. Because at least we should not maybe use the word save, but at least we relieve pain of Ugandans every day. You get? We relieve pain, at least. At least we give life. Henry have cut someone's abdomen, opened their intestine, cut part of it, thrown it away, reconnected them, and they're happy somewhere in the village. A score of them. So you cannot tell me I get the courage to training under that. I come and give this guy, but I get a complication as I give this service. And all I can be is be thrown in a ward and suffer in agony. Then you reach out to my friend Henry Muntasi. Henry Ukurukuntasa at some point, but I can tell you it is not sustainable. So we need, this very week I issued a press statement as chairperson of the Central Branch that government should come up with a clear pool of funds to take care of health workers, both in public and private. Because even those guys in private are treating taxpayers. This very government pays staff for some of these private, not-for-profit hospitals, like non-profit hospitals in Zambia, Lubaga, whatever. They have some of their staffs paid by government. This is on record. It's not mere say. So why don't you want to protect them? If you deploy them there, that means there is a reason why you're deploying them there. So why don't you want to protect them when they become seekers of the services you sent them to give to the people? We all pay taxes, both in private and in government. So this government should be serious. And if this government is not going to be serious, like I know it is not anyway going to be serious, please, anyway, when you get in government, Mitara, James William, when you guys get in government, we're very serious. Eh? You have seen the troubles that we are going through. We're very serious. Those are the things we need. The UMA is calling for withdrawal of the interns, is calling for provision of personal protection. But these songs we have sung, we are tired. Me, I'm tired. That's why ruchane ijao msajja ngatujjao ngatutekolera ebintu byaffe. Mazima getuliko. Government eno yetaaga eveeko tufune government ey'abantu ey'okukolera abantu kati bino ebintu omuntu butono nnyo tusobola obutereeza. Kikola tusazeewo tuddeyo ne ku ssomero twongereko n'ebitabo twongerewo magezi okugunguka naye wali oguli omutima guli ogw'okulaba nti Uganda efuuka y'abannayuganda abali legitimate. Bannayuganda abali legitimate. You know, Henry, when we cannot be able to correct family problems, then we cannot correct community problems, maybe. So we cannot begin to talk about East Africa integration, what, when you have a lot of troubles home. East Africa should help us sort problems which affect all of us as East African countries. But there are things which can be sorted at home, like health care. These should be local solutions. But this government will tell you one thing. European Union, US, you have no say in our affairs. They are not telling the same citizen, they are telling that 45% of the health budget is funded by the US and other development partners. They are not saying that. They are not saying that. But they have the audacity to say they have sovereignty. Which sovereignty? Oliakumulirwano. Ngogambo ina sovereignty from that neighbor. Which sovereignty are you talking about?
Right.
You see, those are some of the questions some of us probably. But me, ndikutozoba kungamba, nine enju yange. Sisobola kufuna mmere. And that happens in real life, okay? But then, guy nangamba, mwana, ngena kwa kusindikirayo omutwalo buli lukiiko lunako okufuna ekyokulya. Then naliko okweragira ku Henry. Nakyo ogamba abantu nga tosobola kweriisa. Uganda yerimu ku ggwanga eritasobola kweriisa. At so many fronts, healthcare, legal, people, social, entrepreneurship, a lot. But those are not discussions for today. But I want to finish my submission by saying, 1, Ebola is here. 2, health workers are victims of Ebola. 3, health workers need to be supported and be given reassurance that when they go in for us, gola summary yange internet neyechanga.
I know. I know, Mr. Dr. Mirembe. First of all, I want to congratulate you for standing up for your colleague, Stephen.
Hello,
And do you hear me, Mr. Mirembe?
am
Dr.
I being
Mirembe? We hear you. Dr.
Yes, I can
Mirembe.
hear you. Me, I can hear you. Me in the US. I hope the rest can hear you.
We do hear you. We do hear you. Dr. Mirembe, I want to thank you for the courage that you exhibit as a leader, of course, and for standing up for your colleague, Mr. Stephen, who is going through a challenge right now. Of course, you have said a lot of stuff that need to be looked at very critically, closely, actually. I wonder what the opposition, specifically the Shadow Minister for Health, is doing in this regard. We have lost him. I wonder what the Shadow Minister of Health is doing in this regard, and if they have any alternative policy approach to how healthcare workers should be protected. Mr. Mitala, I'm going to invite for your thoughts as well, and then Mr. Mugeni as well to share your thoughts.
First of all, I think I am really, I can't find the right word to say, but I think I'm grateful for sharing a platform with Joel Mirembe and listening to the things that he's saying, because he's coming from a very knowledgeable, perspective. He's well connected. He's on the ground. So possibly what he says is more authentic than those of us who are looking in, from so far away. I salute him for being brave and engaging in a battle of such a kind. If I may recall, I think not so long ago, Joel had some problems with the Ministry of Health, because I think his contract had to be ended because they considered him to be unfriendly or uncooperative, whatever that means. I cannot really understand. I mean, for a man who speaks so eloquently like that, a man who speaks with passion, clearly with love for the nation, love for the country, love for the people, and for the passion of the job that he's trained to do, it really it baffles my mind and what is really going on in these kind of situations. But the easier thing to say is that is Uganda for you, which is sad. And I think when that kind of statement is thrown about, I think it's thrown about in much more or less of a sarcastic kind of thing. It's like it's a funny joke, which shouldn't be a funny joke in any sense. I want to think that the government of
Then we have
Uganda,
lost everyone. I don't know why. I hope we are still on.
Mr. Mugeni, we are still on. Mitala is talking as we continue with this conversation. You need to check your headphones and see if they are not betraying you. I'm not sure if you hear us. Mr. Mitala, proceed.
I'll continue while James is sorting himself out. I was saying that I would want to think that from the previous experiences of the previous Ebola outbreaks that we had in 2014, 2015, my inclination would be that possibly we are in a better, as a state, we should be in a better place to be able to deal with this kind of challenges, learning from those experiences that we saw then, and be able to repeat those experiences in the current situation to come out of this problem a little bit more sober, a little bit more smoothly. And to add on to that, we came through COVID. I mean, a lot of money was spent in COVID. I mean, with the vehicles that were deployed at local government levels, down at the lowest point of the extent of
Grassroots.
central government, grassroots, to be, because I think we are told, was it about 2,000 cabin vehicles that were donated by the World Health Organization to be able to cater for things like that, to offer transport, ambulances, transport and facilitate health workers to be able to coordinate this kind of efforts, you know. Surely, let's say the money was eaten, but the cars, we saw the fleet of cars that were, you know, displayed and were given to, you know, government officials to be able to work, you know, in this kind of situation. I mean, we do have the facilities. It's not a question of not having facilities. The facilities are definitely there. The question is, our priorities are just in the wrong place. I am of the view that, and I say this with a lot of pain, because I mean, when we talk about these sorts of things, people paint the picture that, you know, we are not patriotic, we don't love the country, and so on and so forth. I think the people who put up those kind of arguments, I think they are insincere people. I think they are people who don't really have anything, you know, good to say for about Uganda, to be honest, because some of these things, they are very obvious, even to a young child. They are very obvious. I think Uganda seems to be in a place where we are just our government is just incapable of doing anything constructive. I'll draw an example from that. I mean, and while drawing that example, I also want to add on and say that I would like Museveni to be a good dictator who does things for his people. Because if you are a dictator but you get things done in the interest of the people and take them forward, I think people can forgive you that, yes, you're a dictator, you've denied them this, that, but you've taken them towards a certain level. More or less, that is the kind of situation that Paul Kagame is faced with in Rwanda. You know, he's not the best lad around, but I think his people can, by and large, tolerate him because he seems to be a good dictator. A good dictator in the sense that he's taking his country forward. There was a time when our education system was so much, you know, ahead in the region. People used to come from Kenya, from everywhere. When I was at university, we used to have lots of Kenyan students who were coming to the law school because our university, Mackay University, was really an excellent university, and people, because of at the time, I think the University of Kenya, is it? I can't remember what it's called, but the University of Kenya was going through a crisis where there were riots on riots on riots, such that the university a university year could never be completed without being disrupted with some kind of riot or closure. Those were during the years of Arab Moi. So lots of Kenyan students were seeking education in Uganda, and not only Kenyans, but people across Africa were in Uganda to receive education because our education was at that stage. I think when you compare the situation what we have now, you can see that we are on a trend of just going down and down and down and down. And then you really go to question, what is it that our government can do right? What sort of priorities can our government ever get right? Even for the most simple things. I mean, I've just been looking at the Monitor right now, you know, on the front page of the Monitor, and I know this is a newspaper that President Museveni hates because I think even recently he quoted that the Monitor is reporting, you know, as an enemy of the country. I don't know what he meant by that, but there is a headline here that talks about witchcraft politics as being the ugly face in the Ebola fight. And it goes on to say that the National Ebola Task Force has said that the contagious disease could not be, well, that was reported in August, could not be detected because people believed it was not Ebola, it was witchcraft. And therefore, instead of seeking medical attention, they were seeking, you know, advice from witch doctors. So the question is, the point that's demonstrated from that kind of situation is that, and Joel has already touched on it, is there's this lack of trust and faith from the public, from the citizens. People don't believe, people don't trust the public, the government officials. People don't trust the agencies that they are making decisions on their behalf, and that when those decisions are being made, they are being made in good faith. That's really the bottom of the point. So we need to be able to recover. We need to be able to bring back, you know, faith in the system, We need to be able to rescue that public confidence in our systems, because without having that public confidence in our systems, we are really fighting a losing battle, absolutely speaking. So what should be done? One of the things that should not be underestimated, we cannot underestimate, for whatever reason, we must not and we should not underestimate that we are faced with an Ebola outbreak. Because much as the numbers, they seem to be creeping up, they are telling us 24, 35, 50, and so on and so forth. The trend is there that we are evolving towards an outbreak. Therefore, everybody should do what they need to do in order to be able to protect themselves in the best way they can protect themselves. If it means isolation, people should isolate. But at a national level, these are not even my suggestions. These are things that are openly out there. Everybody knows them. They were tested. They were benchmarked during the COVID crisis. These sort of measures should be rebuilt. They should be just resurrected and brought back into system. Test people. Clinicians are saying they are finding it difficult to test, because how are you going to be able to diagnose a problem when you cannot test to know whether somebody is suffering from malaria or suffering from this or this? The elimination process starts with testing. Now, nurses, doctors, they are not able to test because the facilities for testing are not there. The kits for testing are not there. So people are
Yeah.
faced with that crisis. That's number
Yeah.
one. But this,
Just to make a small addition actually on what you have said. Just here, these centers here, government centers here in Kampala. Recently, there are several patients who came in and they were suspected. Samples were taken off. Results came back after 5 days. After 5 days. It's not about that the test of Ebola takes ages to get the negative or positive, but the bureaucracy, the absence of systems that are streamlined, communicate results can be done, then communicating them back is also another trouble. So everyone should get to their job such that this is done. And I was saying from the start that we need to engage the private sector, because there is no patient who comes when he's labeled disease X. It is a finding made after assessing the patient. Thank you. You can continue, please, your submission.
Yeah. So testing is one of those things. I mean, the community contact tracking was talked about, tracing of people who have had contact with these people who are possibly infected. I mean, that was talked about a lot during COVID. It's common sense. Why are these things not being done? That's what the other thing. Joel talked about it, is recruit trusted people and pay them well. People need to, even doctors, they have families, they've got bills to pay, they've got dreams and ambitions. People also want to be well, as much as they are healthcare professionals, and they care for they love their patients, they want to save them, they have sworn to save their patients and do everything within their power to make sure they can save a life. But at the end of the day, their needs are my needs. They want to have a decent life, and everybody goes out of their house to go and work because they expect that they should be able to feed from the sweat of their hands. So recruit people, pay them well. The money is there. Why is the money not being paid? Why is the money not being put in the place where it's supposed to be put? We've seen money being given to fake investors. We've seen money just being thrown about, money disappearing. This money should be going to the people who really need that money to be motivated to do their
There
work.
is one of hydrogen of reset. There's one who came to make flying smart hydrogen.
You see, so the final point I would say is that surveillance of the disease. I mean, as I said at the beginning of my observations, we are dealing with an endemic. This is not. It is. This business has been here with us. We know about it. It's not a new occurrence, really. I think what is really difficult, or what is really challenging and disappointing, is that we've got a whole set of system that is incapable of mobilizing itself. And the reason is simply one, because we are a country of presidential directives. you know, let us allow the professionals to do what they are trained to do. We can provide, you know, oversight. We can provide, you know, the monitoring, and to make sure that, you know, the a correct set of values are applied while they are doing their job, so that they are, you know, they are going about the correct approaches. But we need to enable the professionals to be able to do their job. And I think if you're not allowing the professionals to do their job, because we have got this kind of a situation where we are micromanaged right from everything, it's centralized through one particular individual, you know, we're just going to end up with the same kind of, you know, ugly situations again and again. But briefly, those would be my observations. Again, I put my hand on the chest. I say, people like Joel, you are doing a great job amidst all the challenges. I think for me, if I had a say on who I would call our heroes, you are the sorts of people that I would call our heroes, and you'll be getting, you know, those medals at Independence.
As we head into the 60th Independence Day, you talked about the fleets that were purchased by the Ministry of Health. I think there were 282, and Uganda spent about 23.9 billion shillings acquiring or purchasing those fleets. If that money was given to frontline workers, specifically doctors, nurses, midwives, and other fighters, as Mr. Mugeni referred to them, I think we would have a motivated workforce that is working towards protecting not just Uganda's human resources, but also her human capital. Mr. Mugeni, as you wrap up, I want us to wrap up this conversation, and I'm starting with you. Based on everything that you have heard, what are your thoughts? How should we proceed in ensuring that Ugandans, first of all, know how to protect themselves, because they very well know that if they get sick, probably they're not going to get the needed help or responses from the leaders of government. Mr. Mugeni, you are muted. All right, we are unable to see what Mr. Mugeni is doing, specifically because he's not on video. So we're not sure if he's available. I'm going to invite Dr. Mirembe to wrap up. How do you want us to engage, specifically people like myself and other colleagues who have access to media and can directly speak to the people of Uganda and the people in the diaspora? What should be our role in ensuring that we educate Ugandans, especially those on the ground, on how to protect themselves? Perhaps also, how should we encourage politicians? Specifically, I haven't had a response from the Shadow Minister of Health, so I don't know what their response is regarding this outbreak. If you have had that response, could you please share it so that we could disseminate it and perhaps encourage the government to tap into that knowledge to help all Ugandans at large? Dr. Mirembe.
Okay, thank you very much, Henry and Mitala, for the submission. Mr. Mugeni is back. You made very important submissions, which were clear, articulate, and on point. But like you said, what should the stakeholders locally and diaspora who are Ugandan origin do? We believe that the stakeholders who are not Ugandan know what to do, because it's us to actually give them the direction. But it's us probably who are not yet to the point. But I want to allow the viewers on and those who are going to see this video session later to know, at least to be reminded of the key symptoms of the current virus. Like I said at the start, there are several different viruses. The current one, actually, the very few people are having bleeding. Actually, 89% of these people, most of them have fever, that is sudden onset. They have the general body weakness, joint pains, and headache. Around 60% of them have that. Then we have around 33%, they have diarrhea, they have muscle pains, they have a low appetite, they have abdominal pain, and then 11% have vomiting and unexplained bleeding. That maybe can come from the eyes, from the ears, from the rectum and other parts. Then about the spread, people should know that this disease many times comes into the community from the wilderness. It's a zoonotic disease. So the hunters sometimes bring it into the community because which animals harbor it? The chimpanzees, the monkeys, gorillas, antelopes, in local language here tujite enjobe, that kind of meat. Whether found dead or alive, you touch it, then you come to the community, you spread the what? The disease. Things like namunyungu, porcupine, I think is what it is called in English. So then then what exactly happens? Fluids, whether blood, whether saliva, whether anything from any of these animals, you touch it dead or alive. Touching people who have died from suspicious death, sudden death. Those are the ways this disease, that I was trying to explain how it comes into the community. Then now, after someone has it in the community, it is spread person to person. You must touch that person or that dead person, or you must get a fluid, a body fluid from that person, either from their clothes, or they have touched somewhere and they usually touch there, or they have shared clothes with them and all that. You get? So that's the way we get that disease. It's not spread through anywhere. It is a contact disease in particular. So then, now how are we going to avoid this disease? It's important that our people know. We can even cut out this clip and disseminate it. We are going to avoid the disease by avoiding contact with suspected cases, avoiding contact with people who have died of the same disease. Someone can die, and then because of our cultural beliefs, we smuggle them to burial. Then what? Then we come out when we are actually an epicenter and the source of this disease. We spread to the entire village, to the entire community, and all that stuff. So whether that's disease from that, they are trained people to bury, and the people burying actually take into practice the cultural norms that don't cause the spread of this. So people are given a dignified burial, and this should be adhered to by the ministry, because you know our people, if we don't count them, they are evil to the positive. So train the burial team. Then let us report every suspected case to the nearest health workers. They are told free. I know the response is not yet good in terms of responding, making emergency. But let us report the suspected cases. As we report them, let us desist from engaging, touching, contact with them. Then listen to what the health workers are saying. Then people should also know that when you have malaria and you also have Ebola, the risk of death is very high. Then people who are malnourished, you remember this disease has no cure. It is the body that is responsible to fight this disease. So your immunity at this point is very important, because when you get the disease, it is your body immunity that is going to respond to clear the disease. Then it is very low in these school-going children, because their immunity usually is well developed, and they are young, energetic, and the energy is not just physical but also their immune systems. So mortality is very high in the elderly people. Like I said at the start, mortality of Ebola, of any virus of Ebola, can go up to 90%. So people with comorbidities. So now, this disease heals with a lot of sequelae sometimes. What I'm trying to mean is that when you get healed from Ebola, you remain at risk of several complications, including the disease remaining in you up to a year. You don't have symptoms, but actually you have a risk of spreading to another person, especially in sex, the saliva and other things. You get? So this disease is very dangerous. We need to protect ourselves. We need to combine hands, the opposition, the people of the regime who are well, the few who are well meaning, the regime, at least if it doesn't mean well for us for everything, let them at least mean well, because if the disease affects us who they don't mean well, it will also come for them. This is not about the NRM or the opposition or anyone. It's about all of us, because the disease can kill any of us, whether you are in opposition, whether you're not, whether you're poor, whether you're rich. You can be claimed by this disease, and the doctors will look at you, you will go. You get? Then,
Right.
two, they are proven drugs which really help a lot on this disease. For example, they are anti-immunoglobulins, drugs that can help in the healing process to clear the virus from the body. They are outside the borders of Africa. You get? They're outside the borders of Africa. But this government should import them and bring them and start using them, starting with the health workers who are affected immediately. This intervention should come. This government should bring everything medical needed into the epicenter of Ebola. They should take their ICU facilities. They should take their specialists in managing the complication, because the disease is a disease of complication management. It's not the disease of just giving Panadol. People's kidneys are failing. People's livers are failing. People's lungs are failing. They need people who have a special training in these systems. You get? The general doctors can do their part, but they also need support from these technical people.
Specialists.
Ministry should get to establish actually online platforms where the people in the treatment units can be able to consult the consultants online, even when they are not there. If people cannot go in there, then they should avail online platforms for consultation. You get? So that people can be guided. You get? So
hybrid treatment.
Yes. So for the people in the diaspora, they have always made the statements and good noise about the regime. Sometimes they make noise for the regime to take care of the people who are suffering from Ebola. Sometimes they force the regime, they make noise about the regime to protect the health workers who are the soldiers of this battle. It's high time for them to raise. I should see placards in the UN headquarters and everywhere, so that this regime can be serious. I know this regime is very, very cunning. I wouldn't say, I don't want to say this in my capacity as a doctor and the president of UM. I want to say this in my capacity as an activist. That this regime is looking at how it can lobby for funding for themselves. This is not time for that. The time is to clear the epidemic, because this outbreak, the moment it comes out and it spreads to the rest of the street, it's going to compromise the economy. It's going to make people more poor. You get? Already we are troubled. Let me tell you, Henry, a kilogram of posho, maize flour, is at 4,000. It has never happened in this country. Now, people cannot access kaunga now, which is the food that everyone could access when they are broke. Now, when you add the economy being further broken down by Ebola, it will be worse for us. So we need to protect ourselves from Ebola, make sure it doesn't compromise on the already broken, limping economy, so that we can survive and hold in there as we work to make sure that we bring a leadership that works for us all. I beg to submit, and thank you very much for always hosting us to air out opinions on behalf of the common people. For us, we shall always do that.
Thank you so much again, Dr. Mirembe, for this very passionate and informative submission. Always a pleasure to host you here. We do learn a lot from you, and I hope Ugandans are appreciating and cherishing you as much as you deserve. Mr. Mugeni, your thoughts regarding what Mr. Mirembe said? And
Henry, I think
in
is having
conclusion,
internet challenges. Dr. Mirembe, thank you so much for your submission. I've been listening passionately and keenly, and like I said, Dr. Mirembe, I am a survivor, an Ebola survivor. The certificate is here. And at that time when we had Ebola in 2000, we didn't have this internet connection like we're connecting now. And this is a plus in an isolated world that we are able now to connect and talk. Yes, I'm looking at the report by government of Uganda as of today. They're saying we have 35 confirmed cases, 7 are dead, 18 are probable. There are 18 people who are dead, but 7 are confirmed. And the other ones are probable. They're thinking it could be Ebola. And they're saying cumulative cases currently stand at 54, of which 35 are confirmed. That is bad enough it can spread. And they are saying Ebola has spread so far to 4 districts. They have it in Mirembe, in Chegwegwa, Kasanda, and Kagadi. Yes. I wish as a country, I wish as the world, because as Uganda, this might not be very possible. As the world, we could hold it in those could control it in those 4 districts. That would be so good. You have raised several things, of which some of them, of course, you are putting disclaimers as doctor, but what I want to emphasize and tell you, good medicine, good politics, and good politics will give you good medicine. Today when I was presenting and talking to my colleagues in the allied health profession, I said, this thing can't be government. It's you. Let's reach a level where it is us who know what is right, not government. Government doesn't know what's right. I challenge, Doctor, I bet you, I challenge you, you know more about Ebola than the president of Uganda. So it is you. So how do we get leadership within ourselves, what we call maybe physician leadership, to address this squarely? And we give a country a way forward, because we can't continue. And it is good you're even talking to the diaspora also to come in and like where there's something they are seeing. And why are we in the diaspora? It's not just to hide here and not keep quiet. We are now connected. We are one world. The internet has made the world very small now that I can even speak to you perhaps somewhere, I know some village somewhere, but here we are. So how do we use the internet to connect and to use it effectively to make sure we are now talking as one word? Because sometimes going down on Uganda alone, we forget that we subscribe to World Health Organization, we subscribe to CDC. Actually, at CDC level, this is what CDC is doing. CDC and World Health Organizations are working with the local health authorities to identify sources of transmission, conduct case investigations, and strengthen local laboratory capacity and the human resource. Now, that is World Health Organization and CDC. So how do we get us, those who are fighting, to work together with the CDC and World Health Organization? You know, sometimes we have to bypass Uganda, because this is about death. This is about us. This is about you dying at the front line. So these are very important things. So to me, I don't want you to have a shy eye that you are speaking politics. The disease is bad. It goes wrong because we have bad politics. Simply pure bad politics is giving us poor management of these diseases. So you are not wrong to speak out. Political will must be seen not to dominate, but to create an environment that different disciplines come in to do their part. And that's what governance is all about. It's not about if you. I was so hurt yesterday when I was seeing the retiring generals. You know, they are appearing before a frail man. Museveni himself stands as a frail man, but whoever is talking before Museveni is quaking. Now we need people who are firm. We need people who, I mean, doctor, you know facts about Ebola. Tell the world you are going to die. Tell the people that you are going to die, because the myths are stronger. You know, doctor, I listen, not I'm interested in knowing what is going on in Uganda. Then you find yourself a professional that the only source of information you have is Lumbuye, whom I don't know because he carries clout around him. Then you go to Tamale Mirundi, they having this information, but now where are the professionals? How can we come to challenge that information? Because yes, it's factual. There's a doctor dead, but when it is spun around in the rumor spin that yes, we are trying to on a Tanzanian so that the world, because
can we wrap up, Mr. Mugeni?
It will not count.
Let us wrap
that
up
is
this
dangerous.
Conversation.
So, to me, in this internet world, which connects me and you, it's a strength. The internet world that connects you and Canada, where Henry is speaking from, is a strength. And like I said, when we had Ebola in 2000, there was no internet. So we should be much better now with the internet to connect and fight Ebola. Yes, the fatalities of Ebola is 25%, 25 to 90%. It's 90% if you're not cared for. It's reduced 25%. Chances of survival increase with proper care and the basic nursing care, proper diagnosis, controlling, keeping the infected, isolating and keeping those who are infected from infecting more people. By the way, it is also said, medicine, the way the world disposes of it is dead. The way the world disposes of it is what you call refuse or whatever. Tell you how developed that country is. If you can't dispose of your dead decently, then you're not developed. So those are small, easy things to see. And when they tell you that Ebola is only it's about washing hands. How much have we had an opportunity from COVID-19? People must be washing hands. Avoid contact. Make sure this is a simple thing. Wash hands. Because you have touched something, you'll touch your nose. It's personal hygiene. These are basic things, but how can we fail on such in the 21st century? So, and I don't know whether it's only me and you now summarizing this, because our colleagues seem to have Henry, I think, is back. But to me, Henry, thank you so much for bringing Mirembe and bringing us together. And any other Ugandan who is the diaspora, we are all Ugandans, and we are now a global village. We are connected. So coming is not strange. Coming to speak, and we should speak quite often. It hurts to know that you are in such a world that has almost everything, and then there's another world with nothing. So what about us now who have an opportunity to be here? I think it's good to see that we're relating with our people at home. Thank you so much. And yes, definitely, I also agree with what Muzukulu said. The people who are on the ground are heroes. Ugandans themselves say living in Uganda is a job. It's 24/7 job being a Ugandan. So I salute Dr. Mirembe on the ground. I know what it means to sacrifice your life. And you said you need to have children. Thank you.
Thank you so much, Mr. Mugeni. Thank you so much, Dr. Mirembe, for joining us here today, this afternoon. And thank you so much for everyone who has been following us online. This is the State of the Nation. Next Sunday, we shall be back with a different conversation. Perhaps we need to discuss how government should protect her human capital that would be an important conversation, given what we have heard from Dr. Mirembe today of how professionals are being treated, specifically professionals in the healthcare field or sector. Again, thank you so much for following us. This is the State of the Nation. My name is Henry Ssali.
This is the State of the Nation. Rifa Mwanga. We are deliberate, we are reasonable, we are uncensored. The State of the Nation.